Status of Lubowa, specialized hospital construction under Ministry of Health, half-year performance. Honorable Chair and honorable colleagues, the construction of Lubowa International Specialized Hospital, which is a 243-bed hospital, started in the year 2019, but implementation delayed due to various reasons. However, construction is currently on course and the project is expected to be completed by the end of the calendar year 2025. The overall physical progress as of December 31st, 2024 was at 45%. The project has reached levels that need constant monitoring and supervision, and as such, Uganda shillings 1.5 billion is needed for supervision in the coming financial year. Detailed report and photographs is attached as Annex J. Shillings 1.5 billion is required for the supervision of the International Specialized Hospital in Lubowa. Chair, as you're aware, a consultant was never procured for supervision of that facility. We are using our own engineers from the Ministry of Works and Ministry of Health. The total fertility rate has declined from 5.8 according to the census of 2014 to 5.4 as per the Uganda Demographic Health Survey of 2016, and from 5.2 according to the Demographic Health Survey of 2022 to 4.5 according to the UBOS Census Report of 2024, thus achieving the NDP3 target of 5.4. So, Chair, that is a series of different surveys giving us results. F, Salon is needed as development budget for completion of projects in regional referrals, and shillings 2.7 billion is urgently required for installation of new X-ray machines acquired with support from donors. We have the X-ray machines. We need funding for installation. F, shillings 56 billion for rehabilitation, expansion and equipping of the 3 old dilapidated general hospitals that have been started on by UPDF. This is Masindi, Kambuga and Itojo. G, Butabika. G, Butabika requires shillings 5 billion for infrastructure projects. Naguru requires 1.7 billion for completion of staff housing units. H, maintenance of new imaging equipment, CT scans, MRIs and ultrasound require shillings 7 billion annually. Shillings 12.97 billion is required for maintenance of all the oxygen plants across the country annually. In addition, shillings 18.85 billion is required for procurement of transformers that will stabilize the power supply for the new acquired medical equipment. I, shillings 3.75 billion is required for functionalization of the 36 medical waste incinerators that were acquired with support of donors for waste management in health facilities. J, allocation towards promotion of primary health care in an effort to enhance preventive as opposed to curative approach of health allocations is very critical and demonstrated by 86% of the funding under the sector going to public health services. However, it should be noted that about 70% of these resources are from donors, which is not sustainable. B, allocation towards a phased renovation for the dilapidated general hospitals and upgrading or construction of health center 4s, 3s and 2s to the general hospitals respectively. The allocation towards phased renovation for dilapidated general hospitals and upgrading of health facilities has been inadequate to make any impact. The current allocations are also not released, and this is affecting implementation timelines. C, allocation towards targeted and holistic provision of universal health coverage, as well as progress on the process of finalizing the National Health Insurance Scheme. Chair and colleagues, the Ministry of Health completed all the necessary steps and documentation for the National Health Insurance Scheme, and submissions were made. However, there has been no response on this matter. The paper remains on the Cabinet agenda, and it is making almost 2 years. D, provide a summary of the major budgetary changes in the budget year 23-24. The Ministry of Health procured 116 new ambulances, of which 79 have been delivered and deployed. The remaining 37 ambulances are being equipped and retrofitted with the necessary gadgets and shall be deployed by February 2025. Chair, we regret this delay. The challenge was getting approval of the Global Fund grants because it was procured using Global Fund money. The approval took long. Furthermore, procurement of the service provider also took long. The service provider reported in December and subsequently requested to go home for the festive season. So they just returned a week ago. We regret the delays. The current gap for ambulances is 240, of which 178 are for constituencies without any ambulance. The list of deployed ambulances is attached as Annex K.
Maternal mortality ratio is given as 189, but under NDP4 the target is 50. When you go to the under 5 mortality, the BFP target is given as 52, but the NDP4 target is given as 39. And under the NCD mortality rate, NDP4 is given a target of reducing from 21% to 19%, but BFP does not have a target in that. So we just want to understand the differences or the variances within the targets itself. Secondly, on the unfunded priorities, indicated that we need additional 3.6 billion for operationalizing the blood bank. I actually thought that the figure will be higher because NMS has indicated they need 32.52 billion for them to be able to have the blood collection supplies and devices itself. And when we engaged the UBTS, they indicated with these 3 regional blood banks, if they are operationalized, we can have an additional 90,000 units added onto the 360,000 units. That will give us 450,000 units, and we'll only have a shortage of 10,000 units of blood. And this has been a very big issue that we have been grappling with as a sector. So I would have thought that the gap is actually more than the 3.6 billion shillings that is being talked about. In addition, I noticed also that you did not indicate, in addition to reinstating the 100 billion that is required for NMS, Kawempe Regional Referral Hospital, we noted that there was a 2 billion cut on their budget for the next financial year. It's actually one of the entities where they've had the budget cuts itself. Ministry of Health, it's a 1 billion cut, but Kawempe, it's a 2 billion cut, which will really significantly affect the services. And we thought that this is also one of the budgets that needs to be reinstated. They indicated that they have written to the program on human capital, but they haven't got a response in it. I would want to know whether this is also something that you think needs to be addressed. When we looked at the boards for the different entities, we noticed that there's a variation in the number of board members. Naguru, for example, has 14 board members, while Kirudu has 7 board members, I think together with all the other national referral hospitals. So we wanted to understand the variance between Naguru has 14, while Naguru has 14, Kirudu has 7. And so they are presenting an unfunded priority for the Naguru, the additional 7 indicated. Coming to the annexure G, which is on the Global Fund projects, we indicated that these facilities have already the human resource, the PHC budgets, and also the medicines. And as I raised to NMS, I gave the example of the facility in Kole under number 219. They have the PHC budget, they have the staff, but they don't have the medicines. And they have now been operating for the last 3 months. And there's another 6 months in this financial year where they have to operate. NMS has indicated that they didn't receive it as among the facilities to be catered for within this financial year. So I just wanted also to get some clarification on that. And then on the UCREP budget, there is an indication of 103.8 billion that was restructured. And so we wanted to understand what were the areas where the restructuring was done within this budget. I'm aware that there was one of the development partner budgets were to cater for equipment for health center 4s, such as ultrasound and also other health center 3s. I just wanted to know whether this is the restructuring, and if not, then what is the progress as regard that particular budget. Then lastly, when we went for the regional oversight visits, the issues of renovations for Kotido, Abim, and Apache is something that came out very, very strongly. I think last financial year, they were all allocated resources, but there was no work that was done. This year, there's also a budget of 1 billion shillings each. But again, we just wanted to know whether that has been released, and if not, where is the gap. Then lastly is on theater supplies and surgeries. One of the concerns that keeps coming up is that patients have to pay for surgical services in the health center 4s and other facilities. And when we make interactions with the health workers, the indications they are given is that the supplies for the theater are mainly supposed to be dedicated for emergency obstetrics, implying that anyone who goes for surgical services outside emergency obstetrics then will not be able to be catered for under that budget. So I just want to get some clarification if that is indeed what the policy direction is, so that we can have more clarity on that information. Thank you.